Today we are going to be talking about the most important danger signs in pregnancy which must be taken seriously. I will be teaching you what you will do or what to do if you experience these signs, as there might be a signal that there's a problem with the pregnancy. Hi, my name is Dr. Chandus. You're welcome to my channel where I provide answers to health questions to teach you how to make better decisions about your health. Subscribe to my video to get updates on my content as I post them. In today's video, we'll be talking about some important danger signs in pregnancy. I'm going to be teaching you how to recognize these signs and what to do if you experience these signs, as they are a sign or a signal that there's something wrong or something going on in that pregnancy, and it should be taken seriously. So if you're a mother who is currently pregnant at any stage in pregnancy, this is an important video to watch to the end. So please stay tuned and watch to the end. These danger signs are signs which, when they occur in pregnancy, should not be ignored, as they can mean that there's a problem either with that pregnancy or with the baby or with the mother. So therefore, these are signals which mean, for avoiding the use or repetition of the same terms, these are signs and symptoms which, when they occur, could mean that there is danger or there is a problem, and it must be reported to a health practitioner or whoever is providing antenatal care for that pregnant woman at that time. So without further ado, let us begin to talk about these signals. The first thing I want you to realize as we talk about these signals is they do not mean that you should begin to panic and run around, scream and shout. It simply means that you should see a doctor or see whoever is providing antenatal care for you at that time. So the first sign we'll be talking about is bleeding. So depending on the age, if a woman is bleeding during pregnancy, it could mean different things. It could mean that it's a threatened miscarriage or a miscarriage. It could also mean that there's a problem with the placenta, where one example is placenta previa. If the placenta is low-lying at that point, you could have bleeding from that point. If there's a separation of the placenta from where it's implanted, you could have bleeding from that point. So it depends on the age of the pregnancy. It could also mean that it is just implantation bleeding at early stages of pregnancy. It may not mean, which may just require some rest and all that and watchful waiting. This is why it's important to see a health provider or antenatal care provider at that point, a skilled birth attendant at that point, to find out what is really going on with that pregnancy at that time. The next one we'll be talking about is abdominal pain. This could occur in conditions like placenta previa, which I did earlier explained. It could also mean you could have what we call HELLP syndrome, right? It could also mean preeclampsia to HELLP syndrome. That's hypertensive disorders in pregnancy. That's a disorder, a hypertensive disorder in pregnancy. It could also mean maybe the woman has a coexisting uterine growth, like a fibroid. If you have pain, sometimes you could have pain from that fibroid, which also complicates the pregnancy. It could also mean round ligament pain. There's a ligament to call round ligament. That pain could also be coming from there. So it's important to see a health practitioner who will differentiate this and try to really find out what is going on at that point in time. The next signal includes swelling of the face or swelling of the hands, sudden swelling of the face or swelling of the hands, with or without blood vision or headache. So if you have a woman suddenly, looking very, very puffy or very full in the face as against the way she was before in the pregnancy, you have her hands being swollen, and then she complains of headache, may or may not complain of headache, and then blurring of vision, such a woman needs evaluation. It could mean that she's having a hypertensive disorder in that pregnancy, or at the extreme, which we call preeclampsia. It could also mean, could just be, some women tend to look really full during pregnancy. Maybe her mother was like that and all that. So this is why it's important to see a healthcare professional to differentiate, the normal from the abnormal. The next one we'll be talking about is reduced or absent fetal movement. If a woman, suddenly notices that her baby is not kicking as much as, baby used to kick, that could signal that there's a problem with that child. This is why we advise that women begin to chart their fetal kicks. After some time in the womb, every fetus establishes a pattern. So if the mother has been charting her fetal kicks, and all of a sudden she sees that the baby is not moving, the way it used to move, it could signal that there's fetal distress in that fetus. It could signal that maybe the amniotic fluid, what we call amniotic fluid, that, like a bag of water that protects the baby in the womb, it could mean that maybe you have reduction in that fluid volume. It could just mean that maybe the baby is not, just not moving. It could mean that baby is okay. It could also mean that, in some types of placenta, like if your placenta, what we call anterior placenta, you find that those kind of women may experience reduced fetal movement. But this is not a sign or a signal to joke with at all. It is better to go to the hospital and have the health provider tell you, okay, this is nothing, than to, begin to panic and then avoid the hospital in fear or begin to run up and down. And at the end, you find out there is a real problem with that pregnancy at that time. The last signal we'll be talking about is regular contractions before 37 weeks. Regular contractions before 10 or 37 completed weeks. This could signal preterm labor, that labor is starting before it's supposed to start. So it means you need to have it checked out. If it's nothing, the doctors know what to do. If there's a problem, the doctors also know what to do. So it's better to go and then have this checked out and evaluated. Now, with all these symptoms or signs that I've discussed, it is better to be safe than sorry. It is better to err on the side of caution, Better to rush to the hospital and tell them, oh, I've not been feeling my baby kick since this morning. And they say,
madam, your own is too much. Baby, it's okay.
They check, fetal heart rate is there, is normal and everything. Now, for you to relax and say,
baby will kick later. Or the pain will stop. The bleeding will stop.
You're not a doctor, or you may not have the skills or the acumen, or to diagnose or to know what is going on. So it is better to see your doctor, talk with them truthfully, interact with them, and plan with them the way forward, or the next move to take, or the next action to take, to see that you have a good outcome for both the mother and the child. Thank you so much for watching this video. Remember to subscribe and like, share this with mothers you think may need it, and see you in the next video. Bye.